I have seen so many, and just like they were just pointing out, depression, anxiety, separation anxiety. We've seen isolation. We've even seen an uptick in suicidal feelings, and that's been the most concerning to me because, historically, we would see a few cases, and certainly at the beginning of the year, but even at the beginning of the year, in the middle of the year with the isolation, you had so many athletes who had to give up their careers during that time. And what we know about sports and athletics is that these kids are used to a certain amount of physical activity, and that physical activity was completely gone. So as they return, I'm so happy to see that there's more in school, activity and engagement, but I'm still worried about the kids because our numbers, most mental health professionals, we're just seeing more kids in therapy at this point, more than we've ever seen.
Yeah, the rates of children and teenagers contemplating suicide, particularly in Black and brown communities, should be alarming to everyone. It's an epidemic at this point. But we're seeing the return to the classroom for a lot of kids. But are they still dealing with some maybe carryover? Can they still be experiencing some of that depression or isolation from their time at home?
Absolutely. And part of it is anticipatory. See, two things happen. We completely lost routine. And what happens when they return back to school is, unfortunately, consistent interruptions. You don't know what to expect. You could be quarantined all of a sudden. Your teachers could be quarantined. In other words, and then what happens is that so many kids start to fall behind. I've seen it in my own grandbaby where she's falling behind in math, and she's like a little nervous Nelly, and so the anxiety increases. And so what you're going to continue to see until we see this whole pandemic flatten out, we're going to continue to see these kinds of mental health issues.
And that's so true when you talk about that anticipatory anxiety, because the kids could be in class for a couple weeks and then you get a phone call or an email saying there's a case, and then they're back home, and just the yo-yo of not knowing what to expect. But as a parent, what are the symptoms that we need to be looking out for to make sure that our child's mental health is where it should be?
Well, see, the good news is most of us know our kids. So if we start to see changes in sleep habits or eating habits, eating too much, too little, if we start to see aggressive behavior, and a lot of times with guys, we start to see reckless behavior. And I think, when you see kids start having really negative self-talk, like life is not worth living, or in extreme cases, giving their possessions away, or kids who are normally kind of placid become aggressive, we're going to see physiological, physical, and emotional changes. And at that point, it really is time to dial into what's going on mental health-wise.
And so if we don't per se see those changes, but just want to make sure that our child is doing okay, do you have any advice on ways that we can just check in with them?
Absolutely. I've always been a big proponent of the family dinner and open discussions, and I believe that there should be a check-in every single day. And see, most kids are going to say, when you ask the question, well, how are you doing in school? Fine. You can't ask that question anymore. You've got to be very specific about how you question your kids. Were there any disruptions today in school? Did any teachers have to leave? Well, what's going on in the classes? Do you see more bullying going on? Be very specific about your questions. And if you don't see them meeting the normal demands that they, are used to just getting in there, taking care of, then it's time to do a deeper inquiry.
And also, to add to that, I have to say, devices off. No devices at the dinner table.
Absolutely.
Turn off the TV and really, like you said, engage in those open-ended discussion questions, because we all get as parents that fine, yes, no. But how important is it that adults also address their own needs and anxiety?
Well, it is extremely important for several reasons. One, you've got to be a role model for problem solving and solutions for your children. And if you are struggling with your own anxiety, then you cannot be there and you cannot step up for your children. And so the two reasons. One is that you want to model for your children, and two, you've got to be ready because you don't know when the unexpected is going to happen. I had a case last week where a child's best friend committed suicide, and so the child came home. Mama didn't know what was going on. She was just quiet. She was normally a chatty Cathy, and finally, after an hour, she finally got to the bottom of it. So there are times where you have to be like a sleuth. These are not normal times, and so what we were used to, we were used to being casual about what was going on. If the child had a good or bad day, it was okay. But now we have to be real critical in how we ask our questions, how we monitor our kids, and how we pay attention to their mental health.
Well, Jane, thank you so much for your expertise in helping guide us as parents through this new normal.
Absolutely.